It's not like, oh crap, how long is this going to take to heal? Or how bad is it? It's always, how much is this going to cost? Hey, welcome back. This is Retirement Fundamentals. I am your co-host, Kylee Mollotte, joined with Ryan Anderson. We left off last week with a Part C in Medicare. Today we're going to finish off with Medicare Supplements or Medigap policies. Two different words, same meaning. So we're going to get into that and how that can help you fill in the gaps when it comes to Medicare as just an alternative to Part C. So let's get into it, Ryan.
All right, before we get doing this, we want to kind of recap in case folks haven't watched our last few episodes to see where we are. So we take a moment here and bring us up to speed. If you have worked your 40 requisite quarters and you are eligible for basic Medicare, that's Medicare Parts A and B. Medicare Part A, there's no cost to that. There is a cost to use it. Medicare Part B, this is your skilled labor, doctors, nurses, labs, x-rays. At the recording of this, we're in July of 2024. Your monthly cost on that is $174.70. For your Medicare Part B, that'll cover 80% of your medical bills and leaving 20% to you. That 20% does not have a limit. So it could get really huge if you've got some sort of condition that is an ongoing piece or is very expensive. Decide, hey, it's a good year to go out and get a heart transplant. So spend a couple $1,000,000 on something. So there could be some significant expense to that. In our last episode, we talked about Medicare Advantage plans, Medicare Part C. Today, we want to talk about Medigap policies or Medicare supplements. These are six of one, half dozen of the other. They have two totally different words, but they are exactly the same. They fit in the same box. There's no difference whatsoever. They are absolutely the same type of a thing. So, the thing about these is that depending on which state you live in, will determine the rules. There are some states that have got a birthday rule. Now, actually, let me back up before that. Let's talk about your initial election period. When you turn 65, you're eligible for Medicare Part A and B. You go on Medicare Part A and B. At that point in time, regardless of what your health history is, you have the ability to get onto any available Medicare Advantage plan or supplement plan that's offered in your market where you live. They can't tell you no. And there's no, you don't pay a higher rate. There's just whatever that is, and how they calculate the rates in your area. Your health history does not play into it. However, once you get on one of these plans, depending on which state you live in, if you want to change it, you can sometimes. If your health is good, you can take it, you get asked health questions, you can change it whenever you want to. You can change it every month if you want to. In some other states, they've got something called the birthday rule that within a certain period of time before or after your birthday, you can change plans to either an equal or lesser plan with any company at no cost to you. Um, so that way, in case your plan gets cost prohibitive, you have the ability to go ahead and change to another plan. Now, so just be aware of that. And some of these states, they have got different rules and they're constantly changing. So what might have been the case 2, 3 years ago may be different for your state.
So, Ryan, when it comes to these, Medicare likes to keep you on your toes, right? We have Part A, Part B, Part C, but then it turns and now we have plan. So we have Plan A, Plan C, Plan D, but the main ones that we want to go over today, Plan G, I think it's Plan N, Plan N. We can touch on Plan F. I know a lot of people think Plan F is the end all be all.
Yep.
So give us some information about what that Plan F actually means and if that's still a good fit for you or even if you're able to get on it.
All right, so let's talk about Medicare supplements, Medigap policies. Once you get on one of these plans, they can never kick you off. They can never reduce your benefits. They can, however, change your premiums. And depending on which type of company you work with, whether and their particular business model will determine how often and how big those increases come. And they will come over the course of your time with that particular organization, that particular company. So, Medicare Plan F, this was the Cadillac of plans. This was the one that was out there for years and years and years. Everybody loved it. It was great. You paid a monthly premium and you had no expenses, period. The only cost you had, your prescription drugs were not included in that, but you could go to the doctor every day. You could go see your specialist every day. You could go see whoever you wanted to, and it was covered. And the thing about it is that they actually got rid of this plan a few years ago. If you're of a certain age, you can still be on it and you can still have it. But if you're new to Medicare in the last few years, sorry, you're not eligible for this one. The thing about it though is I actually, when I'd see people on Plan F, I'd actually change them quite often to a Plan G. It had everything that the Plan F had except one thing, and that is there was an annual deductible that it would cover. And that deductible was a couple of $100 as a general rule, but most of the time,
Yeah, typically it's around $200, maybe 226 I think it was last year.
mhm,
But what's crazy about that, cuz they can't kick you off, right? They can't kick you off a plan, but what they can do is take that plan away and then insurance, they're smart guys, they're in it for them
mhm,
too, right? They go off of the large pool of people, so you cut that plan off and no more people can come into that plan. So that pool was once very large is now getting smaller, right? People leave the plan, they can't come on, people pass away, that pool gets smaller and smaller. So what are they going to do to the premiums?
yeah,
Up, up, up. I've met with so many people who are like, oh, I love my healthcare plan, I don't pay a dime. And I'm like, that's interesting. Okay. What plan are you on? And it ends up being a Plan F. And then I'll say, okay, what are you paying per month? And what they would tell me was like, it could be up towards $300 a month for the
mhm,
Plan F. The Plan G, which Ryan was referring to, the only difference is that deductible of $200, and the difference in the premium was always over $70 a
yeah,
month. Always minimum $70 a month. So do the math, right? That's 2 or 3
$840
months.
a year.
You've paid for the
Yeah.
premium.
So I mean, and
Yep.
think about it is now, mind you, we're talking about our personal experience here. So depending on your state, depending on where you're at, those numbers could change a little bit. And so, and
Absolutely.
as far as, and this has been a year or two ago that some of these stories we're talking about, but that was a very consistent thing that you're paying $400 a year for a $200 benefit. That doesn't make sense to me. And so I would go through and I'd run the numbers. But the thing about it is that these plans are wonderful, and there's no difference from one Plan F to another Plan F, one Plan G to another Plan G. The only difference is who do you pay your premiums to? The coverages are
Mm.
absolutely identical. There are no networks. So if the doctors take Medicare, they take you. You can travel with these things. They're
Yep.
wonderful. And the thing about it is that once you're on there, if you've got any health history of something, if you're a diabetic, you've had an organ transplant, or you've got an ongoing chronic condition where you see the doctors regularly, that this is one of those things that when you turn 65 and you start to select a Medicare supplement plan, this is the type of plan you want to get on. I'll just use.
Yeah, I always describe it. Yeah, I always describe it as a peace of mind plan, because you go to the doctor and you know what you're going to pay is a
Mhm.
deductible. So once you pay that deductible, your fear of being in the ambulance, I don't know. At least for me, when I get hurt, the first thing I think of, oh crap, how much
Yeah.
is this going to cost? It's not like, oh crap, how long is this going to take to heal? Or how bad is it? It's always, how much is this going to cost? Because that's just the reality of it, and we
Hmm.
all know it. So it doesn't help anybody when you're sitting in the hospital or you're sitting in an ambulance, and instead of thinking, how can I get better? How can I fight for my life? Or whatever the case may be, you're thinking, how much is this going to cost my family? We can't
Yeah.
afford it. So these plans, they give you that freedom of never thinking about that. I was just having some, I wasn't, but some relatives of mine were having some medical issues, and I helped them get onto a Medicare supplement, and I sat down with them and I said, hey, I know this has been tough on you and you've been in the hospital in and out for the past 6 months, but I just want you to know there's nothing coming your way. And I've reviewed their Medicare supplement with them, and it was just like it was a visual, oh, oh my gosh, because medical bills, they have up to like a year to bill you, right? So maybe you didn't get a bill next week, but you might get it in 3 months. And so just having that weight lifted off of like, okay, that was rough, and that was rough on us emotionally as a family, and now to know that it's not going to be rough financially, that makes things so much easier. And that way I don't have to worry about our finances. I can worry about my health. I can worry about actually getting better instead of saying, I don't know if I can afford the MRI. What is that going to cost? Oh, if I go in the hospital for 3 more days, what is that going to cost? Is that going to reset my part A. I mean, you have so many different thoughts when you're in the hospital or in an ambulance or anything like that. The last thing you want to think about is money. And so these types of plans, that's what they give you. They give you that freedom. It comes at a cost, right? They're not going to be $0 premiums like they are with your part C. You are going to pay a premium, but it's pay a little more upfront so you don't pay anything on the back end is how I like to have people think about it. And they're really great for people in rural areas. I say that because that's where my parents live. And if I would have put them on a PPO or an HMO, they would have been so limited to where they could go. And if something were to happen and they needed to go to a big city, a big hospital, a university hospital, they couldn't. Or they would have to pay big out of pocket. So just having that like, oh my gosh, my parents are taken care of. As a daughter, that is such a relief. And I know for them as well, it's like, okay, if I got sick, that's not going to affect mom. Or if I got sick, that's not going to affect dad. Like, we're going to be fine. So,
Now, the other thing about that is there's another plan in there that I personally very heavily lean towards for the vast majority of people out there. Plan G and Plan N. The Plan Fs are
yep.
wonderful. They're a bit expensive, and you can get equal coverage significantly cheaper by switching to one of these other ones. Plan N, very similar to Plan G, with a couple of changes. Generally, the premium on a Plan N is lower. So if you're concerned about monthly costs, Plan N is a good option for you, especially if you're a healthier individual. They're almost identical with two or three differences here. So a Plan N will go through here and it covers all the same things that a Plan G does, except for two items. The number one, Plan G will cover something called excess charges. Now, this is something that it's becoming more popular. It's very popular in some of the more larger metropolitan areas, New York, Los Angeles, those types of areas. And that is Medicare says, hey, if you go to a doctor and you get uh, test X done, and the doctor says, I'm going to charge $100 for test X. Wonderful. Well, Medicare says, no, I'm only going to pay $70 for test X. And so most doctors will just write off that $30 difference. An excess charge is when the doctor says, no, I'm not going to. It's worth $100. You're going to pay the difference. So Medicare Plan G will cover that. Medicare Plan N will not. It's not very common, but it is a thing out there. The doctors have to warn you in advance before they do it. They can only charge a percentage of. There's rules to it,
Yeah.
but it's kind of bad PR, so most of them don't. The next one is that if you go through and you look at that I'm just making sure I'm getting the numbers right. If you go to a doctor on a Medicare Plan N, you could potentially have up to a $20 copayment. So you have to pay $20 out of pocket to go see your doctor. And if you go into the emergency room, you could potentially have a $50 copayment. So there are some co-payments, some costs there that they could charge you. Some doctors do, some doctors don't. So depending on the company and depending on several different variables, those all weigh into it. So just be aware of that. Again, it's a more affordable option. If you're healthy, you don't go to the doctor very often. If you're going to the doctor 2, 3 times a month, a Plan G is probably the way to go. Now, another big difference between Medicare supplements and Part C Medicare Advantage plans is that Medicare supplements do not have a prescription drug component. You have to get that separately. And so that's something we're going to talk about in a future episode is Medicare Part D. D stands for drugs. Really the only thing in Medicare that makes sense. D for drugs. And we'll talk about the donut hole. We're going to talk about the coverage gap. Donut hole, coverage gap, same thing. And then we're going to talk about tiers and all sorts of things. So that's what you can expect to see next time. So, but as always, thank you so much. Hopefully, this was just a nice, simple way to explain some fairly complex concepts. And as always, if you've got a question, please send us a note. Click the link below and just go ahead and get that to us. We'd love to answer your question in our podcast. The other thing is if you've got questions about your specific plan, if you need help with your Medicare supplement, your Medicare Advantage plan, if you are unsure of what to do and you just like somebody to sit down with you, we can help you with that. Go to retirementfundamentals.org and just go ahead, click on the "You'd like to speak to one of our trusted advisors, and we will send somebody to you.
Awesome. Well, thank you so much for joining us. I'm Kylee Mollotte. This is Ryan Anderson, and we will see you next time.